Welcome to my channel. I'm Dr. Perkins, a board-certified OBGYN, and today we're talking about how long does it take for a chlamydia infection to go away. In this video, we will be diving into what is chlamydia. Can chlamydia cause permanent damage to your internal system? What is the cure for chlamydia? How to know if the infection has cleared after completing treatment, and how to prevent getting a chlamydia infection. So let's dive into our conversation today. What is chlamydia? Chlamydia is an STI, which is a sexually transmitted infection, previously known very, commonly as an STD, a sexually transmitted disease. In the last couple of years, we've really been trying to correctly place terms as they should when it comes to sexually transmitted infections. And so infections essentially are those that can be cured. So when you think of chlamydia or gonorrhea or trichomonas, these are infections that you get them, you get treatment, you clear the treatment, you have completely cleared the problem. But others, such as HIV, we know that HIV, you can control the disease because it's no longer an infection, it's an actual disease to your system, as well as hepatitis and things like that. So the difference here is that we're talking about an STI being an infection that can be cured completely. And so chlamydia is one of them. And so with that, know that it is one of the most common STIs that exist, especially in the United States. And we're actually finding that the numbers are increasing over time. And so with that, it's important that we learn some of the things we'll talk about today to help to prevent them and then to treat them right away. And so before we jump the gun, let's talk a little bit more about the actual bacterium chlamydia. That bacterium, Chlamydia trachomatis, this can be passed from person to person, and this is how the infection is spread. Oftentimes, this happens during sexual intercourse. This could be with oral sex. This could be with anal sex. This is contact from genitalia to genitalia. So whether it's a penis to a vagina, a vulva to a mouth, either way, chlamydia can be passed on. Chlamydia can also be passed on to newborns. It's actually in a newborn nursery, like shortly after a baby is born, we will often give medicines to help to decrease the likelihood of passing a vaginal infection into the eyes of a newborn baby. And chlamydia is one of those infections that we're concerned about. And so with that, babies will often get a cream or a gel that goes on their eyes shortly after birth to protect their eyes from these infections. And so chlamydia can be passed on through contact. It can also be passed on through the sharing of toys. And so it's very important that if you do use toys, that it's important to understand what material it's made from, but you will have instructions as how to best clean and maintain your toys, including how to prevent infections such as like chlamydia and others from actually penetrating the pores of the material and remaining there even in between washes. And so if you do use toys, pay attention to the details and the information that's provided to you in that toy kit that gives you instructions on how to best clean and maintain your toys so that the likelihood of passing an infection on from person to person as you share is decreased. So who's at risk of getting chlamydia? Essentially anyone who has genital contact with a person. So if you're engaging in any kind of sexual activity, you are in general more exposed and likely to get a chlamydia infection. But there are also other categories or subcategories of activities and risk factors that may apply as well. We know that chlamydia infections are most common in younger people, especially between the ages of 16 and 25. And so the general recommendation is if you are a female who is sexually active and a male as well, that between the years of 16 and 25, you may want to consider getting routine STI testing. And that covers gonorrhea, chlamydia, that covers syphilis, hepatitis, HIV, as well as others. And so because of how common these infections are within the younger population, it's important to be tested so that you know whether or not you have the infection. Now, on that note, it's important to know that the symptoms that you may feel with chlamydia could be none. You heard me right. It is possible that you can have this infection and have no symptoms at at all. So there's nothing to trigger you thinking that maybe I have an infection or maybe I have an STI, because the symptoms are not common with chlamydia infections. Testing is very important for you to know. Now, if you have chlamydia and it's been sitting inside of your pelvis, inside of your vagina, your vulva, your mouth, wherever you may have this infection, and it's been there for a very long time, what happens is that you are potentially increasing the likelihood of having damage, especially permanent damage to your pelvic organs and structures. Chlamydia is notorious for causing infertility, for causing higher infections inside of your body, such as pelvic inflammatory disease or PID. It is common for causing abscesses to form on the inside by your fallopian tubes, by your ovaries, around your bowels, your uterus. Literally, chlamydia can cause a lot of damage internally. And so if you have this infection, please, I highly recommend that the best thing that you can do for yourself outside of testing to know whether or not you do is getting treatment right away, completing the treatment, and testing to make sure that 100% of this bacteria has been removed from your system and you have a complete test of cure. Another risk factor we found is that chlamydia infections may be higher amongst men who have sex with men. So the same recommendations would apply. Just get tested, and if you have the infection, get treated so that you can have a complete test of cure. Another risk factor that I'd like to mention is that Blacks and non-Hispanics also have a higher prevalence of chlamydia within the community. And what we've identified is that the reason is that there's less resources, less access to medical care and what is needed for testing and treatment as well in these communities, and not so much because of hygiene or activities. It's literally due to the lack of resources in these communities. If these risk factors don't apply to you, doesn't mean that we should not get tested. We see chlamydia in older populations just the same, those over 25. So as I've mentioned, chlamydia can cause permanent damage internally, and for females especially, this may lead to infertility. And the reason is, as these infections ascend and go higher up inside of your pelvis, they can cause adhesions, scarring. They can also cause your organs to not function as they should, especially the fallopian tube. They tend to be affected tremendously, and with that may cause permanent damage. These are irreversible. These are damages that can't be fixed by surgery or by medicine. Once it has been done, it cannot be undone. So how do you know if you have chlamydia? Well, testing is important. This can be done either by getting a vaginal swab with a provider in a healthcare facility of some kind, or you may be able to give a urine sample, as chlamydia can be around the bladder and the urethra as well. And so either one works just fine for testing purposes. If you have chlamydia, treatment options for chlamydia infections include two different types of antibiotics, either doxycycline, which is given for 7 days, or azithromycin, which is the treatment of choice if pregnant. Both of these antibiotics work marvelously to clear the infection. Now, how quickly does that infection clear? It really does take a good 7 days after treatment has been initiated, and that is with you continually taking the medicines like you should, completing all the antibiotics that was given to you, and 7 days after with no further interaction with the person or the object that likely transferred the bacterium to you. So that means you want to stay away from sexual activity, abstain from it. You want to protect your body, whether it's your upper body or your lower body, from touching any kind of genitalia that may be infected. It is highly recommended that your partners are treated as well. Reason being, the likelihood of you continually having sexual contact with this person who still has the bacteria is pretty high. And if you have contact with that person again, even if you just completed treatment, the likelihood of you getting the infection again increases. And so complete your treatment, have your partner complete their treatment, wait 7 days minimum after completion on both parts before having any kind of sexual contact again. We also know that in the past years, we're seeing a lot more resistance to antibiotics in the community, which means that the same chlamydia bacterium may not respond to the antibiotics that are typically given for cure. And so because of that, it might be important that after you completely finish your antibiotics, that you actually get a test of cure. That means that you go to the doctors, they repeat the testing and confirm that the infection no longer exists. because there's no other way for you to know whether or not there is a resistance in the bacteria that you currently have that's causing your infection. Now, does chlamydia go away on its own? Simple answer is no. And you should never wait to try to see if it will go away on its own. And the reason is, as soon as chlamydia hits your system, the likelihood of it causing permanent damage starts almost immediately. And so you want treatment quickly, and you want to test to make sure that the treatment was effective. A few tips that I have for you regarding how to prevent getting chlamydia. The number one thing that you can do to reduce the likelihood of getting an infection by chlamydia is to use condoms. And using condoms 100% of the time. That means from the initial start of contact, from genitalia to genitalia, all the way to the end of intercourse, and then getting rid of it. It is very important because while condoms are not 100%, they can protect against the passing or the transference of infections like STIs, probably close to about 99% protection, which is pretty good compared to nothing at all. And so protect yourself first and use a condom. Make sure that the condom is not expired. Make sure that it's not damaged prior to use so that you're not being exposed unnecessarily to things such as this. Another option to help to reduce the likelihood of getting chlamydia is to use a dental dam. A dental dam is a material that can be used especially for like oral sexual activity, where it essentially will cover the area. So whether it's the penis, the vagina, and it covers the area so that it prevents direct contact from an area like an organ, like a mouth or a penis or a vagina, to another genitalia. And so it's just a little bit of a barrier there, but it works very, very, very well in helping to prevent passage of bacteria, STIs, and other things in the area. Next, I recommend not sharing toys. Your toys are your toys. Keep them to yourself. Of course, you want to clean and maintain them well, but try not to share them. Lastly, the best recommendation probably out of all of these so far is to have one partner only at a time. Whenever there's an increase in multiple partners and activities as such, the likelihood of having an infection increases as well. I have something special for you today. I'd like to offer you a free copy of my ebook, Hormones Don't Lie. I'm so excited to share it because it dives into the hormones of the female reproductive system, how they change, and how you can best enhance them so you can live your best life. And so to get a copy of that, click the link below, enter your information, follow the prompts, and I will happily send that over to your inbox so you can enjoy and learn as well. And if you enjoyed our conversation today, if you learned, if you have a question, please leave a comment below. I get them all, and I'm excited to hear your point of view and your experiences as well. So go ahead and share. Thank you so much for being here. I'm Dr. Perkins again, a board certified OBGYN. It's my pleasure to be here, and I hope to see you next time.